Hi, my name is John Thompson, and I'm an orthopedic surgeon at Johns Hopkins. I'm fellowship trained in orthopedic foot and ankle surgery. I treat conditions such as sports-related injuries to the foot and ankle, trauma to the foot and ankle, complex foot and ankle deformity, bunions and other toe issues, and arthritis to the foot and ankle, with a special emphasis on total ankle replacements. I see patients ranging in age from middle school through the elderly. I became interested in foot and ankle surgery because the foot and ankle are so complex. There is a dynamic association between the underlying bony and soft tissue structures, and fully treating all foot and ankle pathology requires a comprehensive understanding of this complex interplay. We oftentimes don't think about our foot or ankle until there's a problem, at which time we suddenly may become significantly debilitated. This can affect both our lives and our livelihoods. My philosophy towards patient care is that I treat you as if you're one of my own family members. We will carefully consider all treatment options ranging from conservative care to surgery. My goal is to get you back onto your feet, both figuratively and literally. I decided to come back to Johns Hopkins after training here for both medical school and residency because it's such a unique and dynamic team. We're at the forefront of patient care, research, and education. It would be a pleasure to take care of you and your family.